Everybody hi. Most people have heard that saturated fat is universally dangerous, but modern evidence shows that its risk depends strongly on biology, especially genetics and fat metabolism. For many individuals with normal lipid handling and low cardiovascular risk, saturated fat appears far less harmful than previously claimed. The real danger concentrates in people whose metabolism and vessels are already vulnerable. What the clinical trials actually show? A meta-analysis of randomized trials comprising 17 studies with over 66,000 participants and at least 2 years of follow-up found that reducing saturated fat led to only small, statistically uncertain changes in all-cause mortality, cardiovascular mortality, heart attack, and stroke. For people at low baseline cardiovascular risk, there was essentially no clinically meaningful 5-year benefit from simply lowering saturated fat. Clear benefits emerged mainly in high-risk individuals, especially when saturated fat was replaced with polysaturated fats rather than carbohydrates. This pattern suggests that saturated fat is not an automatic toxin, but a conditional risk factor whose impact depends on the host, genetic, metabolism, and fragile biology. The harm from saturated fat is largely determined by a person's genetic and metabolic setting. This requires a strategy of processing, anticipating systemic failure by monitoring special clinical markers before they cross a pathological threshold. Identifying the fragile system. Individuals with genetically or acquired disturbed fat metabolism such as familial hypercholesterolemia, genetically driven high ApoB LDL or strong family history of premature coronary disease poses fragile lipids and vascular system. In these bodies, extra-saturated fat more efficiently increases atherogenic lipoproteins and plaque burden. This fragility is often signaled by insulin resistance or elevated fasting glucose. High level or visceral obesity drives systemic inflammation. Elevated C-reactive protein indicating chronic low-grade inflammation. In these specific cases, trials show a clear benefit when saturated fat is replaced by polysaturated fats. Without such interventions, these individuals risk a pathogenic crisis, leading to multi-system failure and a rapid collapse of functional capacity. Identifying the resilient system. By contrast, individuals with favorable genetics and intact fat handling do not show major reduction in clinical events just from cutting saturated fat. This resilient system are characterized by normal ApoB LDL levels and healthy lipid dynamics, high insulin sensitivity and metabolic flexibility, strong system coherence, often marked by high heart rate variability, which reflects robust autonomic balance and adaptive reserve. Preserved muscle mass, which acts as a vital metabolic sink. For these people, moderate amounts of saturated fat appear to be a neutral nutrient rather than a primary driver of disease. This is consistent with data showing that different saturated fatty acids behave differently. For instance, certain dairy or medium-chain fats may even have neutral or modestly favorable effect when the overall diet and metabolism are healthy. Toward genetically informed recommendations. The old one rule for everyone approach: which views saturated fat as universally bad, is increasingly outdated. A more precise metabolism-aware view suggests in people with genetic or metabolic vulnerability, saturated fat should be actively limited and preferentially replaced with polysaturated fats, as it clearly amplifies risk in these bodies. In people with favorable genetics and preserved metabolism, moderate saturated fat is unlikely to be a major independent danger if the diet is rich in unsaturated fats and whole foods. Further dietary advice should differentiate groups rather than demonizing saturated fat uniformly. The ultimate goal of medicine is to maximize wealthspan, preserving the portion of life lived with intact identity, purpose, and agency. By moving away from fighting disease as a war and instead steering biology toward its optimal trajectory, we can focus on overall diet quality and the maintenance of systemic coherence rather than fearing every gram of saturated fats. Thanks for likes and sharing.